The next chapter was chapter 10 and 11 that we went through. This was talking about elderly and adults. So what is our role as a community nutritionist when we're dealing with adults? We have to remember that adults learn based off of past experience, and we need to relate that to them. So one of the biggest ways we can get buy-in from adults, if maybe they saw their mom or dad pass away from a heart attack, we can let them know that they are at an increased risk of heart disease, so it may be important to make some lifestyle changes to prevent their risk of heart disease. We talked about some chronic diseases that are important as a community nutritionist. The first one was CVD. That medical abbreviation stands for cardiovascular disease. When we're talking to the public, we want to use lay terms, so we would say heart health or heart disease. Some things that we want to do with prevention and then possibly even treatment goes into some lifestyle factors, and dietary intakes is a big component of our jobs. Some of those modifiable risk factors or some items that we can change are going to be our physical activity, alcohol, smoking, our diet. Those are some areas that we can actually do something and change and decrease our risk. The non-modifiable, I think I said that wrong earlier, sorry if I did. Those that I just named, those four are modifiable. That means we can change them. The non-modifiable are going to be our gender, our ethnicity, and then also any type of family history. Ethnicity-wise, African Americans are at an increased risk of high blood pressure. Having high blood pressure automatically puts you at risk for CVD or a heart attack, stroke, all of these areas. So that's one population. And then we've seen that men are at an increased risk for heart disease until around the age of 55-ish, 60, and then women and men actually come to an even risk. With this being said, we're going to go back and talk about those modifiable risk factors or the things that we can change. Diet is a huge one. We can look at how our diet affects our risk for heart disease, especially looking at our blood lipids. So we can